Welcome back to the channel. Today we're going to talk about hip impingement. I've been seeing a lot of people with hip impingements, and the problem with hip impingement is it's not a fast correction. It can be corrected and can be helped without surgery, but it takes discipline and it's very challenging. Ultimately, the problem is coming from the core. When it comes down to it, every problem stems from the core, whether it's a foot issue, a neck issue. There's ultimately something going on in the core that's causing a compensation, putting extra stress in the body where you're feeling the pain and discomfort. Now, you could have an injury that's happened and your body adjusts, and unless you strengthen and stabilize the core, the problem is going to come back. So we're going to go and look at a step-by-step process of first looking locally at the hip and kind of broadly with the hip first, and then we're going to take the treatment to eventually the core, but it's going to take a few days of video recording in order to go through everything. Okay? So without further ado, let's go look at the hip.
Okay, so here we are looking at the lower extremity, the leg, okay, and all the main muscles that connect and move the whole upper leg, which makes up the hip. Okay, now if you look at all these different muscles, all of them connect and cross over this hip joint. Let's reduce some muscles so we can see it a little clearer. Okay, so here's some deep pelvic muscles that rotate. These muscles, you know, they're external rotators, but they're also really similar to like the rotator cuff is for the shoulder. Its job is to see how it's really close to the joint and detailed and really specific to its attachment points instead of being really broad, crossing over the whole hip joint like these other muscles here. So these muscles here, they're more like rotator cuff muscles where they really just grab a hold of that leg and they keep it inside that socket right there. But if you look, all these muscle attachments here connecting to the hip, and this is like your quad, okay? Your different quad muscles attach right into that hip area. We have some adductor muscles or groin muscles that attach also right here, and then here is a hip flexor muscle, and it attaches right here on the inferior. This is the greater trochanter, and this is the inferior trochanter. Then here's your psoas major and the psoas minor, which really doesn't connect into the leg or anything. It kind of stops right here at the ramus of the pelvis here, the hip bone. Anyway, so the whole point of what we're looking at is how we're going to strengthen the body and improve how it functions because of a hip impingement. And usually what the hip impingement means is the muscles have lost the ability to move the hip and the leg, and either the hip is down, okay, and then when the hip bone, let's see if I can move this in a better position. When this hip bone here comes up and it pinches into all this tissue because the pelvis doesn't have the ability to come up. And that's the cause of like the trunk muscles, the core muscles not being able to move the pelvis up high enough to get down. Another cause is that a person's unable to lift the leg up adequately enough, and the hip comes down and pinches and compresses the tissue right through here. Hopefully that makes sense. But in order to really start rehabilitating and helping out with this hip, honestly, you have to start out kind of far away, because these local muscles and these core muscles, they're really weak. And so we have to really examine these bigger muscles, these global muscles that have the ability to influence the hip. And those muscles happen to be these quad muscles and these hamstring muscles right here. I don't see. Yeah, I don't see the, let's see, is that it? Nope, that's the adductor. Let's see if we can, there it is. Yep, so these are the hamstring, is that, no, that's not it, and hamstring muscle. No, that's the gracilis, that's groin muscle. Yep, okay, so let's back up. So this is a hamstring muscle. Is this? That's a hamstring muscle. That's a groin muscle. And that's a groin muscle. Okay. And then these are quads. So strengthening these muscles first while also loosening. Ooh, if I can get some control here. Loosening up these groin muscles and a little bit of hip flexor, but mostly the groin muscles here. That's what's going to be the key to helping get your hip impingement feeling better. So let's go over some exercises that'll do that. But first, this is just a general idea of what's going on with a hip impingement. You might have a completely different reason. Your main cause could be something in your trunk. It could actually be something in your foot even. But how we know that is by going to my website, link is in the description, to start an assessment and a personalized prescription offer for your exercises so that we can have exactly what you need to do. Okay, $50 a month. With every $50 per month, you get an assessment done by myself, and then I create a personalized prescription to help you get relief from either your hip impingement, your neck and shoulder pain, back issues, whatever the issue might be. If it has to do with your joints and your muscles, then that's what I specialize in helping people with, okay? But enough with that. Let's just go ahead and look at the main cause of hip impingement. So here's a program that I've put together, and this is basic step number one, okay? As you can see, all these are beginner level exercises, okay? In this system, I'm just showing doing it 3 days a week, but honestly, it's probably a good idea to maybe doing it gently every day of the week, okay? Daily. And you're going to want to do a few sets, 10 repetitions, each exercise, except for this last one. This is a stretching exercise. You just want to do really gentle, 30 seconds at most, just one time, 3 repetitions of it out of one set, okay? And maybe like 10 seconds rest in between each one. It doesn't need to be a ton or anything. And then truth is with all these different exercises that I'm doing up here, these 4, 30 seconds, that's the most that you need to rest. If you feel like you're able to let go of the tension in the body after 10 seconds, because that's what's important. What's important is that you got to let go of the tension in the tissue that you're trying to strengthen. And if you're able to do that, then you can start back up again a little sooner. So sometimes 10 seconds is all you really need with these type of exercises, okay? So let's look at this first one, the quad set. Let's click on it. Okay, so it's really simple. All you're doing is you're laying in a comfortable position, okay, and you can be seated on a chair, on the floor, whatever. What's important is that the knee is comfortably straight, okay? I don't want you to hyperextend the knee. It's causing stress or pain or anything like that. I just want it to be comfortably straight. And then all you're doing here, the image isn't that great, but if you can see a little bit right here, the muscles are tensing. And so all you're doing in this exercise is you're just squeezing your thigh muscles all around your knee gently, not to hyperextend, but just to try to start activating all the muscles around the thigh. So you really want to focus on feeling all the muscles around the thigh, around the knee, okay? And if you can get it all the way up into the hip, that's even better, okay? But in the beginning, you just want to focus in on the knee, and then eventually feeling the entire thigh muscle, like the whole thing, okay? Not just the inside, not just the outside, not just the middle, like the whole thigh. You want to feel that contracting. And you want to hold it for at least 5 seconds. A little bit more might be a little better, but it's not really that important. Your best bang for your buck is going to be 5 seconds. Doing it longer will make it a little bit better, but again, the best bang for your buck is going to be then those 5 second repetitions, okay? So we're gonna look at a video of this first. See if you can see it. Nice and easy contracting, holding it for about 5 seconds. Person's going a little bit faster, but hopefully you understand and get what it is that we're trying to do there. Okay, let's go back to the second exercise. Passive knee flexion, heel slides, okay? So this is gonna be focusing a little bit more into the hamstrings, okay? So as you see here, you're grabbing a strap and putting it around the ankle. Now you don't have to use a strap like this. You can use like a towel or some type of rope. Basically you want something that's non-elastic, okay? That way it's not giving, and you're not gonna, you wanna get better feedback for the body with a static, non-elastic band. Then it's really simple. It's just there to bring some support, okay? So what you're doing is you're gonna be, with your own strength, you're gonna drag your foot, squeezing the back of your thigh, this hamstring type of muscle, okay? You might feel a little bit of a glute, you might feel a little bit of the calf. That's okay, but we want you to really feel that hamstring. I'd rather you feel the hamstring and glute than like hamstring and calf. We want to try to minimize how much you're feeling on the calf on this one. That's how come the person is having their foot elevated like this. It's called dorsiflexion. By lifting the toes up towards the knee, that's going to take these calf muscles out of it. Your calf crosses the knee joint right here, and so it can help. It's an assister. It's like your emergency use to help you bend your knee. It's not really good at it. It's better at pointing the foot and everything, but it has the ability to bend your knee, and so it will help. But by dorsiflexing your ankle, that'll kind of take it out of it and allow you to put more focus into this hamstring in your glute. And the glute, you actually have fibers in the glute that come all the way down and cross this knee joint on the, what we call the lateral side, the outside part of the knee. And that's like when your glute's going to engage a little bit and help out. But you're going to pull it as far as you can on your own strength. And then at the very end, when you get to the very end, as long as there's no pain associated in your knee or in your hip, you want to use this band to gently kind of like boost that flexion a little bit more. Now, what I mean by that is you still want to be pulling with your hamstring, but you want a little bit of extra like turbo boost. I'm a car guy. I really like cars, and so turbos are awesome because they help boost the amount of air going into the engine so they can have more power, okay? And that's what you kind of want this to do. You want this little assistance to help boost more flexion, more contractions in the muscle here in these hamstrings, okay? Let's take a look at it with the video playback. Nice and gentle pulling in, and at the very end, add a little bit more force, okay? So gently pulling in, then start pulling in more when you can't do it on your own, right there, that last second there, okay? Doesn't have to be long. Again, it's not very strenuous, very gentle and easy exercises. Okay, that's how come you can do it every day. This isn't about trying to destroy the muscle fibers. This is about trying to improve how the brain and the body are communicating. That way you can have better contractions while you're moving around and your body's using more of the muscles on a reflexive level, okay? Short arc knee extension, very simple, okay? Knee extensions get a bad rep, okay? Knee extensions are not bad if done properly. Squats aren't done if done properly, but all exercises, if they're not done properly, they can be really bad for you. So it's really important that you pay attention to your body and feel what it is that you're supposed to be feeling. So let's look at this short arc knee extension, okay? This is really simple. All you need, right here we have a foam roller, but really anything that's going to allow your knee to bend and be comfortable, okay? It could be a pillow, it could be a backpack, it doesn't matter. As long as you can lay down comfortably, you know, you can even have a pillow behind your head. Just, you want to have no stress in your back or your body or anything like that, especially in your hips, and nothing in your knee either. But we're using a foam roller here, and all we're going to be doing is really thinking about squeezing these quadricep muscles. And again, you want to think about the entire quad, that whole upper leg on the front part of your body, the anterior side of your body, contracting and pulling this knee straight, lifting that foot up in the air. Okay, now the point of this exercise isn't to just lift your foot up in the air. The point of this exercise is to feel these quad muscles straighten this knee. Okay, your body will figure out a shortcut or a compensation in order to allow you to straighten that knee however it can. What's important is that you're using the right muscles to straighten that knee. So you got to really focus on engaging these quad muscles and use those to straighten the knee. Now, a lot of times, if it's really weak, your hip impingement in the side that we're trying to work on, a lot of times you might feel your opposite leg trying to help out. Try not to let that happen. Really try to focus on relaxing that opposite side, okay, and not letting it get involved. It's this bilateral transfer, okay? Your body will use the neuromuscular stability and strength from one side to help do something on the other side. So I really try to relax that opposite side and use the weaker side to get it stronger. Okay, let's go look at the video and see how it's done. Very simple. Yep, holding it for a couple seconds, nice control. Now that's the important part right here. The demonstration, they're not just dropping their leg, okay? So they're thinking about the muscles getting shorter, which is causing the knee to straighten, and then thinking about the muscle getting longer, causing the knee to bend. That's really important on focusing on these muscles. You want to envision these muscles getting shorter, which is what's causing the knee to straighten, and then lengthening the muscles, which is causing the knee to bend. That's just how the biomechanical system works. Okay? So now let's go back. Look at our last strengthening exercises, hip internal, external. So here at the hip internal, external range of motion, this is a mobility strengthening exercise. So the whole point of this is not to like really strengthen the hips like you would for resistance or strength training, like lifting weights or anything like that. This is more about really trying to feel the right muscles working as you're doing things. Now, here's where it's kind of confusing, okay? So if we look at these two pictures here, so this is your starting position. Basically, you want to be in a low stress position. So if it's uncomfortable for your low back to lay flat like this, you can put like a pillow or anything underneath your hips here to kind of relieve tension. You don't want to feel any kind of tightness or pain in the position. Ideally, you're going to want to have your neck straight. So putting your hands on your forehead so your nose not smashing into the floor is more comfortable. Just wherever it takes in order to be in a comfortable position. So this is your starting position. Now in this position here, this is the position you're going to move your hips into. Now it's really easy to use your thighs to do this, and that's what you were preparing for beforehand in the previous exercises. But this one, I want you to think more about your pelvis and your hips. You're more than likely in this phase one, not going to really feel these muscles working very well, but this is where you're going to want to start trying to get that happening, okay? It'll be okay that you're feeling your thighs working, but try to focus on your pelvis more. Specifically, those deep pelvic rotators that I was kind of showing you earlier. Let's see. So yeah, these deeper muscles, okay? Now you're going to feel all of these working also. They're going to help out no matter what. But getting into these deeper muscles as you're rotating the leg across your body, because they help with external rotation, you see how this is that greater trochanter that's part of your femur. Let's go down a little bit further. Okay? So you see how those muscles can pull, bringing this in, causing your femur to rotate out. So this will pull your knee out that direction. Okay? But the other leg, okay, we'll look at this one. The other leg is going to be rotating in the same direction, going across together, but that's going to be internal rotation, okay, even though the foot's going to be going out to the side. And what's going to cause that motion is going to be these groin muscles, let's see, right through here, coming down, okay, on this opposite side. So they're both kind of attached to the same side, but because this one's in the front, it's going to be mostly pulling in from this direction. The other leg is going to be back, so it's going to be pulling in right from here is where you want to try to focus on feeling it. You know, your piriformis, okay, not that one, but your obturator internus, externus, quad fem, those muscles. Okay, so let's go back. So here, this leg is where you want to feel the glute hip muscles pulling across. And for this leg here, those groin hamstring muscles is what you're going to want to be feeling pulling your leg out this direction. Okay, let's look at a video to see what that looks like working on it together. See, pulling across, obviously going across the body can go a little bit further because there's more range of motion, but because your pubic bone is down, there's going to be less range of motion for your arm, or excuse me, for your leg to move across. Okay, I hope that makes sense. So now let's go back and let's look at this last inner thigh stretch. Okay, so now this is all of these exercises in some fashion is causing other muscles to lengthen. Okay, so if we go back, this motion, in order to create these motions with these hips, certain muscles have to shorten in order to cause you to go into that range of motion. Other muscles have to lengthen to allow it. So you might feel some stretching going on, but that's not the focus. The focus is trying to increase that strengthening, okay? Same thing with this one. The focus on this one is to get those quad muscles to shorten, but you might feel some lengthening going on in your calf or your hamstring, maybe even your glute. In this one, the focus is trying to strengthen the hamstring muscles and glute muscles, but you might feel the quad muscle stretching and even the calf muscle stretching if you have your foot up, like we were talking about. And then this one, you're probably not going to feel much lengthening at all because you're in a static position or a stationary position, so let's not worry about that. Okay, but this one that we're getting ready to look at, this is a directly mostly stretching exercise, but what helps with that is actually squeezing the opposite muscles. So these are your groin adductor muscles. So the opposite are your abduction, your abduction muscles, which are your glute medius and your glute maximus, glute minimus muscles. So think about squeezing those side butt hip muscles as you let gravity help pull your knees down. Now, if you have a hard time getting in this position on the floor, you can have like blocks, like yoga blocks are really easy. That's what you can do at a gym or something like that. And you can sit on them so that your butt bones are on top of it. But you can use books, you can use pillows, you can use anything that's available that allows you to sit up, but let your knees be free, your legs be free, and your feet be free and touching on the ground, okay? By having your body lifted up higher, it just increases range of motion and your ability to go a little bit further. So there's nothing wrong with doing that. It's a great assistance. It allows you to have better quality work. So that's something that you should do. So then what you can do is just control and let gravity bring your knees down as low as they can comfortably go. No pain, no discomfort or anything. You should feel some stretching going on in those groin muscles. And think about those abductor muscles, those glute muscles, helping pulling down a little bit, but then just gently, very gently, adding like 5-ish pounds of pressure with your hands to try to increase that lengthening. Now the focus is going to be just stretching out these groin muscles, not so much as strengthening these glute muscles, but you do want them to be contracting because that's how the body works. The glutes have to shorten effectively in order to cause the adductors to lengthen effectively. Let's see a video of how that all works. Nice and easy. Squeezing the glute muscles to bring it down, adding a little bit of extra force, holding it there for 30 seconds, and then just relaxing everything. And then repeating whenever you're ready for it. Okay. Let's go back to our anatomy atlas. So again, this is just the beginning portion of trying to get your hip impingement going. The focus is at first is going to be these quad muscles right here, followed by some hamstring muscles, then some hip glute muscles, and then opening up these groin muscles. Okay?
So there you have it. The first step in helping the hip impingement get relief. Okay, so all those of you that are suffering from hip impingements and need help, this is step one on how to find relief. Now, in the next week, we're going to go over step number 2. That's going to help you get relief. Now, there's 3 full steps. Okay, so start taking these exercises and start applying them and seeing how they can help. Now, if these don't seem to be helping you, then that's probably because you're not a typical person that needs help with these hip impingements and needs some kind of personalized custom plan done. So again, use the link in the description, click on it, and sign up for my assessment and exercise prescription. Thanks a lot. I appreciate you waiting to the very end. I'll talk to you again soon.